As a single mom, it's a lot. Sorry.
It's okay. This is going to save people's lives.
Yeah.
I mean, it truly is, and we're going to be talking about that as we go forward. As Mary Poppins used to say, a spoonful of sugar helps the medicine go down. But today's medicine doesn't just come in pill form. We've entered the age of at-home injections. Insulin and GLP-1s may be the first things that come to mind. But this goes far beyond that. We're talking about treatments for autoimmune diseases, severe allergies, fertility, growth disorders, cancer therapies, hormone replacement, migraine prevention, osteoporosis, and blood disorders. Now, what used to require trips to the hospital, handled by doctors and nurses, are now do-it-yourself injections. For millions of people, these medications are not optional. They are life-saving. But here's the flip side. It's now up to all of us to know how to do a proper injection. That means patients of all ages, from kids to the elderly, are not only expected to take these medications correctly, they're expected to travel with them correctly, track their use and dosage, and maybe most important of all, keep them at the right temperature. And that's exactly why I've teamed up with TempraMed for this Dr. Phil Envoy TV special, Dose of Reality. Now, let's start with the story of someone whose entire adult life has involved injection after injection. Ginger Vieira has lived with type 1 diabetes since she was a teenager. She's also an educator, an advocate, and the founder of Diabetes Nerd. Here's Ginger's story.
My name is Ginger Vieira, and I've lived with type 1 diabetes for about 27 years. I diagnosed my own diabetes when I was 13 years old during the 7th grade health fair, but nobody believed me for like a week until I started crying because I felt so terrible. In my early 20s, I realized there was so much more to learn about managing insulin every day than we could ever possibly learn at the doctor's office. It's so much more complicated than most people realize. It can be really scary. Things can go wrong really easily because we're trying to micromanage something that our body should be doing for us automatically all day long. That's why I've spent the last 20 years creating books, articles, and videos on Diabetes Nerd. And we recently launched the Diabetes Nerd Network, which is helping people learn about clinical trials and really cool research that's happening right now trying to cure type 1 diabetes.
Well, Ginger, thanks for being here. Listen, for people that don't have diabetes, talk about what it takes to manage insulin every day, because this is not an easy thing.
It's so much more complicated than people realize. In your body, with a fully functioning pancreas, your pancreas is producing insulin, small amounts every 5 to 10 minutes in response to your blood sugar,
Right.
which is changing constantly. My body doesn't produce any insulin. So I am trying to replicate that incredible process with injections or an insulin pump.
How often, in terms of your conscious thought, do you have to be mindful about this throughout the day?
It honestly doesn't stop because the insulin I took at breakfast is still active in my system for 4 or 5 hours after that dose.
Yeah.
The meal I ate for lunch could be digesting for 6 or 7 hours. Your pancreas manages all of that, actually in combination with 5 other hormones.
Right.
My body isn't regulating insulin production, but the cells that should be producing insulin are normally also supposed to be talking to the cells that regulate 5 other hormones. So the whole system is out of whack. I'm trying to copy all of that manually myself.
Yeah, and that's something that most people just take for granted because it just all happens automatically.
Right.
But you have to manage this on an active basis, a conscious, and with a great intention, right? Because if it gets out of control, it starts to have serious impact.
I mean, even just planning a dog walk is complicated, because if I want to walk my dog at 1 p.m., but I ate lunch at noon, the insulin I have in my system is still active at 1, then you add exercise to the mix. Now that insulin is going to work harder, and my risk of low blood sugar on a simple dog walk is very likely. Right. And then the long-term complications of too low and too high is what we're all worried about all day long. 10 years from now, will my eyes still be healthy from blood sugar management over the last 10 years, right?
Yeah, so you're making dozens and dozens and dozens of decisions every day. I mean, this is something that, it sounds like a full-time job.
It's exhausting. I think if I didn't have type 1, I probably could have built a rocket by now.
Yeah, of course, with all the cognitive energy. And one of the things we're seeing is now the responsibility for managing this is shifting from the doctor, the nurse, to the patient. And so this is a lot of self-management on your part, which is a lot of responsibility on your part.
It's very, I mean, insulin is very scary. Just a teeny bit too much, and you are having a severe low blood sugar event. Not enough, and you're fighting high blood sugars all day. And imagine, you know, your child being diagnosed at 11 months old or 6 years old. It's so much harder than mainstream society realizes. I could have my insulin in my hand. I could have an apple and peanut butter on my plate. I'm trying to guess how many carbohydrates are in that apple. And they're not all the same, right? So I am trying to estimate how much insulin my body needs for that apple, but then I have to factor in 42 other things that can affect my insulin sensitivity in that moment and the hours after. So the low blood sugar fear for something that I eat every day never goes away.
What's the worst case scenario when you've miscalculated, gotten it wrong in some way?
Severe low blood sugar is very scary. It starts out mild, right? You start to feel a little fuzzy, a little lightheaded, a little sweaty. But I've had low blood sugar where I had to crawl to the kitchen, pull oatmeal off the counter, pour dry oatmeal in my mouth, and then I passed out in the carpet. And I woke up about 45 minutes later, and I was okay, but that was back in the day before continuous glucose monitors existed, which do help us stay safer.
Yeah, of course. How temperature sensitive is insulin? What's the range?
It's so delicate. It's so delicate. I actually, when I was 19, I had my insulin in my pocket, and I was stringing Christmas lights up outside the movie theater I worked at during 10-degree weather in Vermont. And I didn't know it, but the weather killed the insulin, destroyed the insulin in my pocket. I took it that night before bed. All night I wasn't getting active insulin. And I woke up the next morning in diabetic ketoacidosis because my blood sugars were so high.
Yeah. You know, I think people really miscalculate this. We always read about side effects and all that, and most of the time they don't happen. And it always says, you know, this medication needs to stay between this and this, these two temperatures. And people are like, oh, yeah, okay, they're just, that's some science.
Yeah.
In the real world, they wouldn't let it be that sensitive. And they don't take it seriously. But it is very serious, because if you get outside that range, particularly if you get on the high side, it really deactivates the medication. And so when you take it, you think, okay, I'm good. I've got the right dosage, when in fact you don't.
Right. I mean, even just leaving your purse in a hot car in the summer is really dangerous to insulin if your insulin is in that purse.
Yeah.
You can't do that, because just 10, 15 minutes in that hot car with 95 degrees can destroy your insulin.
Yeah, so that's a problem, and I want people to take that seriously. We're going to talk about that some today. So thanks for telling me your story. I hope people hear that, and we're going to add to this conversation. When we come back, the hidden risk of self-injection medications and what most people frankly, are getting wrong.
That's where you can have a life or death situation.
Yeah. What's the biggest mistake that patients make in managing what you're just describing? What used to require trips to the hospital are now do-it-yourself injections. For millions of people, these medications are not optional. They are life-saving. And that's exactly why I've teamed up with TempraMed.
Any injectable is temperature sensitive.
You have a product that protects the medication from getting too warm or too cold. To learn more about TempraMed, visit TempraMed.com. That's TempraMed.com. Well, we're back with Ginger Vieira. Now I want to bring in Dr. Susie Solomon. She is a pharmacist, a healthcare leader, and the founder of the Pharmacist Moms Group. Now, she's been on the front lines advocating for women in pharmacy and fighting for better public health. So welcome. Thank you for being here.
Thank you for having me.
You've been in this fight for a long time and really have done a great job spreading awareness. So thank you for everything that you do.
Thank you.
I mean, it's really important. Now, look, we're at a moment where more and more treatments are being delivered by injection, from insulin to GLP-1s to biologics, peptides, other specialty medications. I guess a lot of this is going the injectable route because some of these just won't survive digestion, right? It breaks them down.
Yes, exactly.
And so you got to go around that and go straight into the bloodstream or the tissue. Is that the issue?
Exactly. So we're looking for more precise treatment, and sometimes injectables are the only way. So if you're looking for something that's going to act quickly, like an EpiPen, or something that really won't break down in the stomach, then you need to use an injection. That's basically, for a lot of these, that's the only way you can get the medication.
Right. And that does allow you to control the dosage exactly.
Yes.
And know how much is getting to the patient, where if it goes through the digestive tract, there are differences. Some of it may break down, some of it may not. So there's much more precision with injectables if they're done right and if the medication is protected along the way.
Exactly. So the prescription is one part, but then it's really after you get the prescription, how you handle it. So the storage, the timing of injection, how often you're using it and when you're using it, and then the administration and how you're actually taking it as well and administering it, if you're administering it in the right place.
As this is shifting, as I was talking with Ginger, she's making dozens and dozens of decisions every day, and the management is shifting to her on really serious issues. Yeah. And as it moves out of the clinic and into the home, talk about the level of patient responsibility, because it's gone vertical.
Definitely. And I think that a lot of these medications years ago might have even been just administered by a healthcare provider. And now the patient has a lot more responsibility. And it's often, there's just so much that go along with it. So education is really important for the patients to make sure they understand the medication. Because one thing is, again, just getting the prescription and having it and taking it, but then really how to use it and using it accurately, making sure you're rotating injection sites, for example, and you're not injecting the same spot over and over again, because that impacts the drug. Or if you're using the medication and you're not storing it properly, a lot of these are now protein-based medications. These are not chemical medications. And since they're protein-based, they're structurally sensitive. And so based on the temperature, it can actually change the way the protein is and in effect make it inactive.
And if it gets hot once, for example, like let's say you leave it in the car, your purse or whatever, and we have a day like we'll get sometimes in the middle of the winter in Texas, it'll jump up to 90 degrees and people aren't thinking about it. Once it gets too hot, it doesn't come back. It doesn't recover, right? Exactly. It's ruined forevermore.
Yep, it's ruined. It's just ruined. And you can't see it. So it's not that it's just like you're going to look at it and it's going to look yellow or cloudy, or you can't tell. But once it's exposed to the temperature, the protein will actually change structure. And because of that, that's it. So you only have that one shot. Yeah, then it's done.
Yeah. And so what happens when, because you can't see it, there's no monitor, it doesn't have something where it pops up red, or something says, nope, this one's out of zone, whatever. What happens to a patient that continues to use that medication?
So that's where this discrepancy comes in, because they might still inject themselves and all of a sudden say they have diabetes and they're coming back to clinic and all of a sudden you see all these high blood sugars and you're thinking, wait, we need to raise the dose of your insulin, something's going on. But oftentimes it's not that. It's actually because it was improperly stored and the temperature impacted the medication, or you're on a GLP-1 and all of a sudden you're not losing weight anymore, and it's not about the actual injection, it's actually how you stored the medication and what happened.
Yeah, because it's not just about insulin, which is a critical medication that can have immediate results if they're not getting it or it's deactivated, but it does involve like GLP-1s, epinephrine, other biologics. There are a lot of different medications that are affected by this.
Definitely. EpiPens are big ones because oftentimes patients will come to the pharmacy and they'll ask for 3 prescriptions. One for the house, one for school, and one for the car. And that one in the car is really sensitive. So if you're leading an active lifestyle, which most children are, who might have an allergy and they're going to practice and you're leaving the EpiPen in a car and it's not being regulated with the temperature, that's where you can have a life or death situation.
Yeah, what's the biggest mistake that patients make in managing what you're just describing?
Just not really paying attention to where it is. So they're leaving it in the car and thinking that it's okay. And it's not because they're careless, it's just more that there's so much responsibility that falls on the patient now with these medications. And so it's more about education, I would say. So from my perspective, I think that it's important to educate yourself as much as possible on these medications when you have them.
How quickly does it go bad? How quickly can it spoil? If you leave it in a car, for example, or just carry it with you to a sporting event or something and it gets out of range, how quickly can it go bad?
Within a couple hours, within an hour. I mean, so even transporting the medications from where they're made into the pharmacy, there's spoilage as well. So it can happen very quickly. The other thing to think about is freezing. So sometimes they'll transport it with an ice pack and then the medication will freeze. So it can either heat or freeze, and that will also impact it as well. Or if you're traveling or if you're living any kind of active lifestyle, it would impact it.
Yeah, so it's high side and low side.
Yeah.
What is the typical high side? I know it's different from medication to medication, but is there a general range that people need to be cognizant of?
86 is the number typically, so 86 degrees is the typical number. But I always just say room temperature because I don't think, on both ends, I just say room temperature is really where these medications are stable, and a lot of them are stable for 28 days. But if you're outside of the room temperature, that's where you might, that's where you will have an issue.
Yeah, and pharmacists need to talk to the patients when they come to get the medications, right?
Yes. Yeah, definitely.
Because one of the things that I'm concerned about is we have a real problem with literacy in this country, and as much as 20-25% of high school graduates can't read the instructions that they get on a prescription. I'm not saying just the label, it comes with everything that explains it. They can't read it and don't understand it. So they need help, they need support with this stuff. So I really appreciate you adding to all of this. Now, when we come back from Dr. Solomon to Dr. Mom, what it takes to manage a young child's diabetes every hour of the day. Can you remember the last time you ever took a really deep breath?
No.
Just ever been able to
Yeah.
just relax? It's hard.
Yeah.
And you have to feel such empathy for her
Yes.
having to go through this when all the other kids don't.
Mhm.
If you're asking yourself, what's more stressful than giving yourself a medical injection? Some people hate that. But what is more stressful is the responsibility of giving one to your diabetic child, knowing you have to give it right every single time. Now, Shannon McKelvey's daughter was diagnosed with type 1 diabetes at just 6 years old. For the past 2 years, her family has been managing treatment every single day. You know why? Because it's there every single day. There's no question about it. Thank you for being here.
Thank you so much for having me.
This is like a part-time or extra full-time job, right?
Absolutely. It's probably the most full-time job I've ever had.
Yeah. And take us inside your typical day. I mean, how much of your family life revolves around managing your daughter's treatment? And I know you're teaching her as you go, but how much of your family life revolves around it?
It truly is nonstop. This morning, actually, at 3:45, I was woken up by her CGM alarm. So we actually had 3 emergency lows this morning before coming to visit you.
Okay, and tell people what CGM alarm is.
Sure. So her CGM is a continuous glucose monitor. So it is a device that she wears on her body to alert and help me know what her blood level is.
Yeah.
So it alerts me as to whether or not she's too low or too high. And so this morning in particular, it was too low.
Yeah. And did you have that growing up?
They didn't exist when I was growing up.
Yeah. So you just had to feel it and live it.
Test strips, but they only gave you 4 test strips a day.
Wow.
Oh, wow. Yeah, that would be a whole lot different situation.
Yes, we've done test strips as well, and we continue to because, you know, technology is phenomenal, but we do have some safety faults as well.
Yeah. So talk about the challenges most people never see.
Sure, it is just around the clock. So while she's at school, we have a phenomenal care team, and she has a nurse at school. And it's just the extra preparation, the making sure that before she goes to school, not only does she have her regular school bag and her lunchbox, but she also has her needle bag and her fanny pack. So my daughter constantly is prepped with an emergency fanny pack where she has her cell phone to be able to monitor her blood glucose level, which is associated with her CGM. Mm-hmm. She also has emergency low snacks. And any other medical needs that she has in her fanny pack. And then her needle bag, which has her insulin and all the rest of the devices.
Talk about the emotional toll that this takes, not just on your daughter, but on you as a mom manager.
As a single mom, it's a lot. Sorry.
It's okay.
Decision making about nutrition, what we're eating, making sure that she eats at particular times so that she's regimented, being aware of all of the extra unforeseen circumstances that also affect her blood, trying to understand my now 8-year-old's who was diagnosed at 6, her 8-year-old extracurricular lifestyle. You know, will she be doing activities? Will she be outside in the heat? Managing all of those extra little decisions constantly and preparing for those and making sure that I have all of the extra emergency things in play, but as well as letting her enjoy her life. She's a child, she's 8, and I want her to have her birthday parties. She's turning 9 on Sunday. So to just be able to make sure that that reality is still an 8-year-old's life. She gets to do the things that her friends get to do.
Can you remember the last time you ever took a really deep breath?
No.
Just ever been able to just
Yeah.
just relax? It's hard.
Yeah.
So there has to be a lot of stress that comes from keeping the medication, as we were talking about with our excellent skilled pharmacist, Susie. Just, you have to make sure that you've kept everything right temperature-wise, so you don't think you've delivered what she needs when in fact you haven't, because it's inert.
Absolutely. We actually have experienced this in the short time she's been diagnosed. I actually did receive a prescription that I had to call the pharmacy back and inform them that it wasn't cold. And so we were able to go back, and they were wonderful, and they provided a cold insulin pack for us. So, and we've also done a number of different road trips where I've driven from Canada to Texas and back. And in the summer, when it's 105, we have definitely had to make preparations to make sure that the locations that we're staying at for the evening, or even just where we're stopping, are going to be able to have a place for me to freeze ice packs or stop at gas stations that will allow us to have Ziploc bags filled with ice so that I can put those in a cooler in the car. And then make sure that, you know, if we're on flights where the device that we're using is also permitted on the airlines, and then so that we aren't too close to ice packs and that it's not freezing or overheating.
How much stress would it take off of you if there was a system that supported that, anticipated every one of those needs, and provided you with that technology so you didn't have to find somewhere that had an ice machine? How much would that help?
It would be amazing. I would definitely get hours back of my day.
Yeah, well,
Yeah.
That's the key, and multiply that times the millions of people that face what you face, and it's just something that is so necessary, and we're going to be talking about that as we go forward. Thank you for sharing your experience, and please tell your daughter happy birthday. Happy 9th birthday. We've been talking to real people with real stories and real challenges managing at-home injections. You're probably relating to this 100% because so many people now deal with at-home injections of all different kinds. When we come back, we are going to talk about a real solution, one you need to see and one you're going to want to know about.
If you or someone you love is tired of unexplained high blood sugars, constant insulin anxiety, or wasting $700 insulin pens because of temperature damage, then this discovery could change your life. You know that heart-stopping moment, checking your blood sugar after taking insulin, only to see those numbers skyrocketing. Your stomach drops. You did everything right, but something's wrong. For those of us living with diabetes, it's that constant nagging fear. Is my insulin actually working, or am I just throwing away hundreds of dollars on medication that's secretly failing me? No more racing thoughts about whether your insulin was too hot in your car, too cold in your bag, or damaged from sitting on your nightstand. Here's the terrifying reality.
Insulin is actually very fragile and needs to be stored in a certain way to really work the most effectively. Insulin can actually freeze, and that can ruin the insulin. The other issue is, what if you just do nothing and leave it in that hot car? The insulin actually degrades and loses its potency.
We've all been there, watching our numbers climb despite doing everything right, second-guessing every dose, throwing away hundreds of dollars of questionable insulin, living in constant fear of ketoacidosis. That's why the diabetes community is buzzing about ViviCap, the first automatic insulin protection system that works as hard as we do. This isn't another high-maintenance cooling case or another device to charge. It's literally click and forget protection, using the same technology NASA trusts in space. Because let's be honest, we have enough to worry about with diabetes. It's why over 100,000 people like us have switched. Real people, real diabetics, real protection. FDA registered because our lives depend on it. Think about your last ruined insulin pen. $700 down the drain. ViviCap costs less than one wasted pen and protects every dose for years. Your next insulin dose is coming up. Will you know for sure it's working?
You know, we've heard about the incredible benefits of at-home injections for patients and for the healthcare system, but we've also heard about the responsibility that comes with it. Now, Ginger and Shannon have lived it, no doubt about it. But now I want to bring in someone who's focused on solving one of the biggest risks with self-injections, making sure these medications are kept at the right temperature. So I'm here now with Ron Nager, founder of TempraMed, and Julia Becker, his vice president. Listen, you're the brand builder here, but Ron, you're the one who came up with this brilliant solution, and we talk about it as the last mile. So tell us about this. What motivated you to do this?
Well, several things, I think. First thing is that my father was a type 2, so I realized, he was diagnosed at the age of 70 until 84 when he passed away. He had to inject several times per day, and I was aware to the burden that it brings to him and to my mother that has to take care of him, which was not easy, as you can imagine. Second, as a person that has been in this industry trying to relieve a little bit the burden of people that have to live with diabetes, trying to find solutions for them. Or in one of the meetings that I had, there was another guy that I met with. He is with the industry. He's using a pump, and he told me that while he was doing that, he forgot that his vial that is used to refill the pump, while the pump is on him, the vial is not. And he lives in California, so very often he just left his bag in the car. And the next day, when he was using the pump, the insulin or the blood glucose level was not where it should have been. So that together with the problem that my father had, and the fact that I realized that for many years, insulin companies were trying to find a solution for heat-stable insulin. But as an engineer, I took a different approach and found a device that can address not just the problem for insulin, but for all other medications.
How hard has it been to educate people to realize just because you're taking a medication doesn't mean it's effective?
You know, it's been very important for us to make sure that patients are educated and actually know that their insulin, or any injectable for that matter, is temperature sensitive. And it's shocking to know that a lot of people don't actually realize that the injectable that they're taking in high temperatures, summer or winter, is actually compromised most of the time. And that's a huge problem as well, because the industry and pharma isn't educating people on those issues either.
That's what I mean. You don't hear people talk about that. I mean, it's buried in the information.
Yeah, it's buried
in the instructions. And I've done a lot of investigative work with shoplifting and organized crime, for example, and people steal these medications and they wind up in a warehouse or an 18-wheeler in Georgia, and it gets to 120 degrees in there. Then they sell them on eBay for half price. People buy them and think, oh, hey, I'm getting a great deal here. I'm getting these for half price. They're getting nothing.
Yeah.
It's got to stay within range. It's absolutely critical. And for some reason, this hasn't been pushed. People don't understand this strongly enough.
And it's not visual. You cannot see it.
Yeah.
Okay. The first problem is that, as we heard before from the pharmacist, is that there's no way for the person to know ahead of time whether the medication, the injectable medication, is going to work or not.
Yeah, if it turned milky or something, you go, oh, yeah, that's spoiled.
Yeah.
If milk spoils, you go, oh, that's pretty obvious. But it's not the way with medication. You've addressed that as well, and which we'll talk about. So what exactly does TempraMed do?
TempraMed brings product that try to take a little burden away from them, from the fact that they have to manage medications every day, 24 hours. Our product works 24/7, 365 days every year without requiring them to make any intervention, basically. We our target was to bring product that take the burden away and not having products that will require them to do any other thing. That's when it comes to maintaining medications at the right temperature. And on top of that, we've just learned that many people that are required to basically record every injection that they make. Now, imagine that you are an insulin user, you're using 4 or 5 injections per day. You have to record each injection like that, how much was injected. That's a lot of burden. So one of our products, the Smart product, takes that burden away as well. So our target eventually is to allow people to live their life with much less burden than they have today, be spontaneous and worry-free.
Okay, so let's talk about the product. So you have a product that protects the medication, the injectable, from getting too warm.
Yeah.
Or too cold.
Too cold.
You keep it within range. Tell me about that product.
Well, we have several of them. The first one is for insulin and GLP-1 pens. It's pen agnostic. It works with all pens. And so all the patient has to do, basically, take this is an insulin pen. That's the drug compartment or the insulin compartment. It comes with a cover, with a pen cap. So for the temperature protection, what is required is to replace the original pen cap with our VV cap. That's all. Now, even if you leave it in your car by accident and it's 140 Fahrenheit, the insulin inside will not go above room temperature. So that's what the technology is doing for you. And you do not have to make any preparations. You don't have to charge anything or use ice packs or basically you have room temperature in your pocket wherever you go without any hassle. So it comes.
So no batteries, no power, no charging up,
no chargers, no charging. It has a battery that allows you to understand what is the temperature status of the device inside, or what's the temperature inside. You can see here that by pressing this button here, you get a green light. What happens is that there's a temperature sensor inside that measures the temperature every time you activate it. There's about 5,000 activations before you need to do anything. So basically, it lasts for a few years of life. So that's the VV cap. We have the same technology applied also to larger pens like biologics, for example. It's basically doing the same. All you have to do is put your biologic pen inside, in this case, the TempraMed, and it's protected. And as I said, also, the other thing is that people have to record every injection that they make. So the other side of the VV Cap, now we're calling it VV Cap Smart, you can see here has a timer that tells you when was the last time that you took an injection. You use it for taking an injection. Basically, this allows you to avoid injecting too frequently, which is which might lead to a severe consequence of.
Can I look at this?
Yeah.
Yeah. Oh, so it has a readout.
Yeah, it has a readout,
Yeah.
and it also connects to an app that every time this goes, every time you inject, the app comes up and asks you how much was injected. You can use voice or just the keypad to punch the number, and that information is now going to be recorded. You can share it with your parent. You can share it with your healthcare professional. So every time you come to the doctor, you don't have to manually register everything.
Yeah, this is important for some of us who can't remember why we went in the kitchen this morning. This is really important. Okay.
I have to add that even because I take so many injections a day, it's sometimes hard for me to remember if I did take my injection.
Yeah.
I was like, can I picture it? And so being able to look at that and see, okay, I did take it, or no, I didn't. would be
Yeah,
really helpful.
it gets worse, by the way. Coming up, we all know someone taking GLP-1s, often by injection. But what most people don't realize is the level of commitment that it actually takes. So we're going to talk about that and why all of this matters so much. We'll be right back. Welcome back to Dose of Reality. Look, with all the talk about Ozempic and other GLP-1 medications, we often skip over the most important part. Not the hype, not the weight loss, the reality of actually taking the medication correctly, staying on schedule, taking it the right way, making sure the medication is properly temperature regulated. How crazy are you going to feel if you've been struggling with this for 6 weeks and realize you've been injecting nothing because you didn't manage the temperature? It could all be for nothing. So let's bring in Natasha Robinson. Why did you start taking Ozempic?
I started taking Ozempic in January of 2022 because I had been on other medications. My body makes too much insulin and they weren't working properly. So I found out about Ozempic and actually asked my doctor about it.
Yeah. And when you started taking it, what changes did you notice? What was the impact?
I noticed pretty immediately that I felt a lot more energy. I felt much less like I was struggling with the day-to-day issues that I had had because I started losing weight as a side effect pretty quickly. I noticed that my inflammation went down. Specifically, first I noticed it in my face, that I looked a lot more healthy than I had felt and looked for a while.
And was it tough to manage the injections?
Yes, yes, especially finding a spot on my body that wouldn't cause as many side effects. Absolutely. And then also with travel and children and sports, all sorts of things going on in our lives, trying to make sure to stay on track is a challenge.
How much planning did you have to do to manage this and get it right?
I had to put it in the calendar. I still actually use my notes app to help me with the dates and the injection sites that I'm using.
I think people think it's easy. Do you think they underestimate what it takes to do it right, to manage it responsibly?
Absolutely. I think until you get into the groove of using the medication after a few months, you don't necessarily understand the importance of, where you're taking it, the injection site, when you're taking it, making sure that everything's at the correct temperature. All of that is incredibly important.
Yeah. You can sometimes forget, did you take it, did you not take it? Have you had those moments where, did I do this, did I not do it?
Absolutely. Yep, absolutely. So that's why I keep track digitally so that I'm able to know.
Yeah. Have you ever been cognizant of the heat range, too hot or too cold? Was that something you were aware of?
Absolutely. We've had a few strong storms that will knock out our power, and making sure that the unused Ozempic pens stay at the correct temperature is absolutely a concern that I've had a few times.
Yeah. Okay. And we've been learning about TempraMed. Does this interest you? Is that something when you hear you go, okay, this makes sense to me?
Absolutely. With a busy lifestyle, it takes one less thing off of my memory and my plate that I have to remember. Absolutely wonderful.
Look, thanks for coming and talking about this. We appreciate your insight, so thank you for being here. When we come back, how TempraMed is using space-age technology to transform medication management. This is important information, so please, you want to listen with both ears. We'll be right back. Welcome back. I'm here with Ron Nager, founder of TempraMed, and Julia Becker, vice president of the company. And we've talked about the temperature challenge and the burden on patients. So I want to talk now about solutions. TempraMed talks about space-age technology. So I want to talk about what that actually means, how that technology works without charging ice or anything external. So Julia, this is, to me, a huge solution to a serious problem.
Exactly. And you know, when we refer to space age technology, what we're really referring to is technology that's inspired by advanced insulation systems that oftentimes are used in space to protect extreme temperature fluctuations, and oftentimes that temperature control is mission critical. So what we've done is adapted those same principles and used the same materials for a device that works in everyday, day-to-day lives. So a patient knows that they have a device that's not only durable, reliable, but technology forward that will keep their medication safe from the summer, the winter, just any temperature fluctuations, and they go on their day-to-day.
What's the broader impact on patient confidence and treatment compliance? Because this seems like this allows the patient to become such an active member of the treatment team by managing this responsibly with a plan.
Absolutely. So let's break down the technology just really quick. So there's essentially two lines of defense in our devices. The first line of defense is a very small insulation chamber that protects the heat or cold from actually hitting the medication which is in the device. The second line of defense is what's called phase change material.
Right.
And at basic principles, you take your device with your medication into the summer or the outside temperature that's, you know, summer weather. That phase change material will actually absorb the heat, protecting the device, and you can go on your day without thinking about it, reducing the burden to the customer or patient. They can go to the beach, they can go to soccer, they can, you know, enjoy vacations, traveling, without having to think about the safety of their medication. When you re-enter room temperature or ambient environment, that same material then releases the energy or the heat into the environment and recharges. So that passive thermal system actually works 24/7 automatically for years. So that technology is what creates the confidence around the safety of your medication. So we know if a patient knows their medication and trusts that their medication is safe, they are confident in taking it on a day-to-day basis or multiple times a day, which adheres to compliance and usage compliance. And on the flip side of that, if their medication is actually safe, it reduces waste because the medication is not exposed, the medication isn't damaged. And of course, that can be frustrating, and as we've heard, very expensive. So cost actually comes down.
You know, TempraMed started to solve a specific problem, but how do you guys see the future of injectable medication management? Where is this going? Because you've added elements already that seem, for someone like me, so critical. Where do you see this going in the future?
I believe that there are going to be more treatments around that are going to be given by injectable medications. So at the end of the day, more responsibility to the patients, more injectables coming to market. People must have solutions that will allow them to use those medications properly, and most important, without adding additional burden to the already complicated lifestyle that they have to do.
If this is going to shift to the patient, then we need to give them the tools that support them. I'm looking at it selfishly. It gives me all of those things. It gives me the tool to keep it where it needs to be, the medication in the range that it needs to be, and the structure and the system to monitor it so I know A, that it's okay, and B, what I've done and not done,
Yeah.
which is critical. So what does it cost?
The fact that it works every day, 24/7 for years, it comes down to an expense that is just few dollars per month. And in comparison, according to a calculation that we made, it may save thousands of dollars per year for a patient.
Oh my gosh, if you ruin one set of medications they send you, whether it's a box of GLP-1s or insulin, you burn through a couple of those through mismanagement, you'll pay for this in a fast hurry.
Yeah.
And you've demonstrated how easy it is to use. You just take the cap off and put this cap on with
That's
the
it.
biologics, the GLPs, the insulin, whatever. So, I mean, anybody can use this and figure it out. So
Yeah.
it's very easy to use, right?
It is. And we're coming also to address additional aspects of it. And we've heard before that once you keep the unused medication, you used to keep it at the fridge at home. Well, the fridge at home is not like the fridge in the hospital or in the pharmacy. And you know that if you put medications back at the back of the fridge, it might freeze and then ruin your medication. So
Right.
so there's another need, and we're working on a solution like that also to support more than one injectors that you basically put in your fridge, all your medications there. If you need to go, just take your box with you. That's it.
Yeah.
Again, you don't need to prepare. You can be spontaneous and make sure that your meds are kept at all the times at the right condition, even if there are power outages or something else.
And just further to that, just to jump in, because our technology is at core of our products, we're actually in discussions and looking at other critical verticals and channels. You know, if you think of first line defense, ambulance services, military services, hospital services, when you're thinking of blood transfer and organ transfer. So really, because we've patented and this proprietary technology that we have and we've developed, we're looking at expanding our product offering quite substantially across different verticals outside of just medication management.
Yeah, it just seems like so many applications for
Yep.
what you have here. It just seems amazing. So thank you for coming on and talking about this. I think people are going to embrace this and use all of the different elements of what you have to offer now. And I think we're going to see this, as you say, across a lot of different applications.
Absolutely.
Congratulations on solving a problem here.
Thank you.
Thank you.
Thank you.
To learn more about TempraMed, visit TempraMed.com. All the information is there, and use it. Of course, they can go there and get this and have it shipped straight to them. Anywhere else they can get this?
Yeah, and great question. So our product has actually been validated in market already. So 150,000 individuals have bought our product online through Amazon.com, Walmart, Walgreens, and we're actually working on getting our products in pharmacy networks across the US, which we anticipate towards the end of this year. On a secondary note, we are actually working with a number of large payors, and we're really targeting the insurance companies from an education perspective to start carrying our product for their customers. So we have partnered with Humana, which at this point I think is the fourth largest insurer in the US, covering 15 million lives or so, and it's a very important part of our expansion plan.
Any other places they can get it?
They can get it from Optum, and I think also through the clinics of the Veteran Affairs.
Okay, great. And so it's not covered by insurance yet?
Not yet.
It may be soon?
We are
Yeah.
working towards reimbursement
towards
within the US,
Yeah.
and then of course expansion globally outside of the US as well.
Well, it's going to pay for itself either way really quick.
Yes.
Yeah.
So thank you guys for coming on and talking about this. This is going to save people's lives.
Yeah.
I mean, it truly is, and it's certainly going to de-stress a whole lot of people.
Yeah.
So I appreciate it. Thanks for being here. We'll see you next time. What used to require trips to the hospital are now do-it-yourself injections. For millions of people, these medications are not optional. They are life-saving. And that's exactly why I've teamed up with TempraMed.
Any injectable is temperature sensitive.
You have a product that protects the medication from getting too warm or too cold. To learn more about TempraMed, visit TempraMed.com. That's TempraMed.com.